Okay, you guys, I just thought of something too. Because I sit here sometimes letting my mind wander as a physician as to what would be necessary to handle this, Because some of us, a lot of doctors have opinions. A lot of us are trained in places where infectious disease was a reality every day. I trained in LA County where tuberculosis was a reality every day. 10% of the residents in LA County converted to PPD positive every year. In other words, 10% of the doctors in LA County turned positive for tuberculosis every year. Every year I was there, okay? So let me make sure you understand the context from which I examine these things. So, with this virus lasting as long as it is going to last, and the fact that it's going to be ever present for most people don't recognize these kind of things don't like disappear and go away forever. No, you get them under control. So, the thing that I was talking about is that the level of testing that you need. Let me explain to you the level of testing that you need. For some jobs, they should be testing you every day with a quick 15-minute test if it existed and was available. Then they should be able to test you that as you enter your job. Every healthcare worker should be tested on their way. They should have a special healthcare worker entrance. And whereas you enter the hospital to work, they check you, ask you questions, and administer a quick test. That needs to be done. So you need a quick test, and you need a lot of them because you need to test them every day. Testing healthcare workers once a week is not adequate. If your nurse is working in the corona place, she's going to probably get it. Testing her once a week is not enough to identify it. So you need a rapid test. And then you also need a rapid test readily available everywhere. Imagine this. Every time you go to a restaurant or the movies, either you have a rapid test on admission or you show them your badge, which is a photocopy, which has a photo of you, and your certificate of immunity. Now, this is what I mentioned this to Thornton Dickerson. He would say, well, then they should be able to verify that and scan that badge with a barcode and verify it with a national database that you are indeed immune. I said, yes, they should do that. And since people are going to counterfeit the badges, they should have a system that ties into the internet, that no matter where you go, they can scan your certificate of immunity and see your picture and that you qualify. You should have to do that on the way into the movie theater. Have I gotten across to you the degree to which your life has just been interrupted? I hope so, because that's what you're looking at. The virus is not going to go away. We're going to get it under control, and one of the ways we're going to get it under control is to utilize these methods. Again, I don't know, as a liberal, leftist, whatever you want to call me, I don't know how to make all of this jive with your civil rights. As far as I see, we're going to have to sacrifice your civil rights. If you want to go out in public, not wear a mask, have parties, we need to arrest you or fine you seriously. Seriously. So it should be. If they come and find you having a party at your house with 25 people, $2,000 fine. Yeah, and put your name in a database of the stupid people that do stupid things during epidemics so they can monitor your stupid ass. Right. They should have a special database with stupid corona people that they can monitor your ass because you're a dum-dum and a risk to everybody else. Okay, so this is what's coming. I just want to make that prediction for you. You'll be glad on the day when they have the certificates of immunity and the badge, and that you'll be able to call. Like, I'll have a hotline number. If you don't believe this person's certificate is correct, call the hotline number and check and see. So you'll be able to call a hotline number and tell if the certificate of immunity is valid. That's what's coming for you. Mario Hemsley, once again, giving you a neo-urban heads up. Peace and blessings.